Good afternoon, and welcome to Legionella Risk Management, Centers for Medicare and Medicaid Services Rule Update. Today's webinar will review the roles and responsibilities for developing a water management plan for Legionella risk management. It's my pleasure today to introduce our speaker, Patsy Root. Patsy is the Regulatory Affairs Manager from IDEXX Water and has over 12 years' experience in water-related regulations and environmental laboratory accreditation. She has worked with a variety of regulatory agencies worldwide in attaining approvals, validation, and verification of IDEXX methods. She has worked on several large-scale method validation studies, including with the Environmental Protection Agency under the Alternative Test Protocol, and is a longtime participant in standards development with TNI. Patsy is a past committee member of the ASHRAE Legionella Standard 188 and is actively involved in many industry organizations, including but definitely not limited to the American Water Works Association, AOAC, and American Public Health Laboratories. Before turning it over to Patsy, I would like to remind you, as Connie said, that questions can be submitted at any time during the presentation. Thank you so much, Patsy, for being with us today.
Thank you, Nancy, and welcome, everybody. Appreciate you taking the time out of your day to join us. So what we're going to go over today is a little bit about Legionella as a background, talk about the Centers for Medicaid and Medicare Services memo that came out just about a year ago now, the environmental health's role in Legionnaires' disease risk management, with some information about the CMS memo, water safety management planning, validation and verification testing, and as Nancy mentioned, a Q&A session at the end. So first of all, I thought, maybe some of you in the audience might be thinking, how does this relate to me? And why should public health be involved in water safety management? And, four things really came to mind for me about why this is important. And for me, the first and foremost is that between 8,000 and 18,000 people in the U.S. contract Legionnaire's disease annually, with a mortality rate between 10 and 25%. So that's really very significant and something that we all should be paying attention to. Legionnaire's disease bacteria, Legionella pneumophila, is the #1 waterborne pathogen globally. CDC reports that 90% of cases are preventable, though, when a water safety management plan is put in place in a building. The last reason why I thought this would be important to you all is that the public turns to public health laboratories when they need guidance. Public health laboratories are the gold standard. So let's talk about the characteristics of Legionella a little bit. So it's an aerobic organism. It is gram-negative, though it doesn't gram stain very well. It is a non-spore-forming organism, flagellated, pleomorphic, and a facultative intracellular bacteria, which we'll demonstrate in a couple of slides. And these are the causative agent of legionellosis, which is an umbrella disease that includes specifically Legionnaire's disease, which is a severe pneumonia, and Pontiac fever, which is more self-limiting and flu-like. So where do Legionella live? Legionella like to live in water. They are a waterborne pathogen. They live in both potable water and non-potable water, and there are some examples here, and some of them that you might not think about normally. Certainly faucet water or shower water, but most people don't think of ice machines. I know I believe it's the UK that they've actually banned ice machines in hospitals. Non-potable water sources can be things like cooling towers, pools and spas, but also lines like for dialysis and dental water. So that's pretty much where Legionella will live, anywhere that we have water that people have access to. The other thing is that Legionella really like biofilm. They're a very stable structure, and they act as breeding ground. So if you're not familiar with biofilm, if you think about like when you may stick your finger down in the faucet in the drain in the bottom, it might feel a little bit slimy. That's actually the biofilm, and the organisms really like to live there. They create these communities of organisms that include Legionella, and they're very protective in a biofilm because disinfectants really have a hard time getting to the organism when they're in a biofilm. And there's some pictures of biofilm in a pipe on the bottom. The one on the right is rather disgusting, but the bacteria like it. The other thing that Legionella specifically like are living inside of amoeba. So what happens in the biofilm is amoeba are swimming along and they consume parts of the biofilm as a food source. Well, part of that food source might include Legionella. And for certain amoeba, the Legionella then become prey and they consume the amoeba from the inside, and then they burst out and they become free living again, and they're in the water column again. And that is actually pretty typical of what happens in macrophages deep in the lung when the Legionella get breathed in, excuse me, and they invade macrophages pretty much in the same way they invade amoeba. So we know where they live. How do they get to us? The infectivity route is through aerosolization. So in other words, anytime water is aerosolized, either in a shower or with the handheld shower thing in your kitchen sink, or through aerosolization of a cooling tower water, and the bugs are in the water, and then when it's aerosolized, you have the opportunity to breathe it in. So really, Legionellosis has 3 infectivity risk factors. One of them is exposure. So the Legionella has to be in the water. The water then has to be aerosolized. And then the virulence of the strain, it has to be a pathogenic form of Legionella. And then the susceptibility of the patient. So the patient has to be either, the risk factors are over 50, current or former smoker, COPD, immunocompromised, and hospitalized. So all of those factors really have to be present in order for there to be the highest risk of infection. So now that we know what Legionella are, where they live, and how we can become exposed to them, how do we reduce the risk of Legionnaire's disease? And the Center for Medicaid and Medicare Services has a program for that. So for those of you that might not be familiar with what the Centers for Medicaid and Medicare Services are, they are actually a regulatory body that writes rules and regulations that are codified in the Code of Federal Regulations in Title 42. If you're familiar with EPA, the EPA's regulations are in Title 40. So it has the same functionality of creating rules and regulations as EPA. The specific sections, though, within Title 42 state that certain buildings must have, and I quote, an active program for the prevention, control, and investigation of infections and communicable diseases. So this section of Title 42, the covered facilities are typically hospitals, nursing homes, short or long-term care facilities. And actually, just about this time last year, the CMS came out with a memo. And what this memo did was it reinforced the regulations that were already at CFR 42 about the fact that hospitals and nursing homes and covered facilities under the CMS rule were to have a water safety management plan in place to reduce the risk of waterborne pathogens and including Legionnaire's disease. Specifically, what the CMS rule said and reiterated in this memo was that Medicare-certified healthcare facilities are to have a water management policies and procedures to reduce the risk of growth and spread of Legionella and other opportunistic pathogens in building water systems. So the CMS had 3 basic requirements in the memo that came out last year. The first of which was to conduct a risk assessment. Where could the pathogens potentially grow in a specific hospital, a nursing home, a rehabilitation center? The second was to implement a water safety management program. And the third was specifically about monitoring, how they were going to test and the methods and ranges that they were going to have for the pathogens in the system. why the increased focus on Legionnaire's disease from CMS? Well, Legionnaire's disease is on the rise. According to the CDC, the reported cases have increased over 400% in the last 15 years. And in the beginning, I stated on the first slide that there are between 8,000 and 18,000 people that contract Legionellosis in the United States each year, and that really is an estimate. A lot of good sources and key opinion leaders believe that that number is significantly larger than that. And 10% of the known cases are fatal, but if the Legionnaire's disease is contracted in a healthcare setting, the mortality rate is 25%. So 1 in 4 people. Another reason why CMS is focused on this is because Legionella pneumophila is really the #1 waterborne pathogen. So this data, also from CDC's Morbidity and Mortality Weekly Report, is for the year 2013 to 2014. And it talks about some bacteria that we're pretty familiar with from environmental water testing. So if you look at, for instance, Cryptosporidium, there were a lot of cases of Cryptosporidium that year in 2013 to 14. But if you look at this line right here, this is Legionella pneumophila. There weren't as many cases, but look how many of the hospitalizations there were relative to the number of cases. And then the green bar is the number of deaths. And this was just in 2013 to 14. So like all bugs, not all species within a group of organisms are considered pathogenic. If you think about some other common water testing that we do is looking for E. coli, right? We often look for E. coli in drinking water. We understand that not all E. coli are pathogenic. Not all of them, when we're exposed to them, are going to make us sick. And Legionella is the same way. You know, you might be exposed to certain Legionella, and they're not necessarily going to make you sick, even if you have all 3 of the risk factors. But predominantly, the one that does make people sick and the one that has this very clear connection to Legionnaire's disease is Legionella pneumophila. And Legionella pneumophila versus other species is typically what you find and what's shown here in culture-confirmed cases. Now, this data is actually from the European Center for Disease Control, and it has the years 2009 to 15, and anywhere between 95 to 99% of all of the cases that were culture-confirmed were actually due to Legionella pneumophila. And there are a few other species listed on the bottom that show the occurrence of Legionella pneumophila is much higher for Legionnaire's disease than any of the other organisms listed there. And actually, Bosemoniae, I believe, is strictly soil bacteria. So not all Legionella are equally pathogenic. Legionella pneumophila is far and away the most pathogenic of all the waterborne Legionella species. And for confirmation of that, the World Health Organization, I think last September, put out a statement. The European Drinking Water Directive is actually just starting to go under revision. And what they're thinking about is adding Legionella to it. And what the World Health Organization did is put out a statement saying that focusing verification monitoring on Legionella pneumophila instead of Legionella species was the way to go. And in addition, it said that when a microbiological parameter is defined taxonomically, the parameter is much less prone to being ambiguous. So even the World Health Organization has put out this pretty strong statement in support of Legionella pneumophila. So the other thing that is important to understand is that also in June 2017, at the pretty much the same time that the CMS memo came out, the CDC's Vital Signs publication also came out. And in that publication, the CDC stated that 9 in 10 outbreaks were preventable if the building had had more effective water management. 9 out of 10 of those outbreaks. So in addition to making that very clear statement, the Vital Signs publication went on to say that the state and local officials have roles that they can play in helping to manage Legionnaire's disease risk in a way that CMS has stated to the covered facilities. And what they say here that I've highlighted in the bottom is that the state and local officials can provide tools and information to help healthcare leaders create and use water management programs. So public health labs and officials can make a difference by building awareness in their community through outreach to these healthcare facilities, share best practices for prevention, including how water safety management plans are written, and connect with facility owners and managers to provide valuable resources and information. So specifically, what healthcare and public health laboratories can do is know the industry standards that CMS recommends to create water safety management plans. Know the steps and the people involved in water safety management planning, the teams, and help them get together. Understand what validation and verification are and the role they play in water safety management planning. So the first thing we're going to talk about with those 3 bullet points is what are the standards that CMS referred to in the memo of 2017. And they're both here, ASHRAE 188 and the CDC Toolkit. ASHRAE Standard 188 came out in 2015, and it's the only ANSI-accredited standard out there. And the CDC Toolkit is actually a distillation of ASHRAE 188. It's really the entirety of ASHRAE 188 written in plain language, and it includes a lot of checklists. It includes some FAQs and what to do if you see this and what to do if you see that. So it's really 188, but in plain language and very easy to work with. And a water safety management plan, a good one, has 7 core activities, and this is directly from the CDC Toolkit. So the first thing is establish a water management program team. We're going to talk about that in a bit. The team then describes the building. Simple text, simple pictures. Then the team identifies where Legionella could possibly grow and spread. Then the team decides how control measures should be applied and how to monitor them. This is verification. Establish ways to intervene when control limits are not met. How do we fix things if things aren't what they should be? Make sure the program is running as designed and it's effective. That is validation testing. And then document and make sure that the program gets improved over time. Now, the most important part of this is to establish a water safety management team. And that team has to have a lot of different knowledges associated with it. Different people are going to bring different perspectives and different understandings and different competencies to the team. The first thing is the building owner or manager should be on the team. Maintenance, engineering, plumbing people should be on the team. Safety officers, equipment and chemical suppliers or chemical treatment people, contractors, water treatment professionals, certified industrial hygienists, microbiologists, including laboratory services, environmental health specialists, the head of health services, state and local health officials. So the ones in blue, now this list is from the CDC Toolkit. The ones in blue are the folks that can probably come from public health. So state and local officials from various organizations can participate in water safety management plan team, putting a team together. Folks from the Association of State and Territorial Health Officials, the National Association of City and County Health Officials, Environmental Council of States, they can provide people with knowledge about environmental health, microbiologists, hygienists, safety hazard officers, and sanitarians. All of these people can participate in water safety management planning with the healthcare facility. And everybody brings a different piece of key knowledge to the team. The ability to oversee the program, probably the managers. Knowledge of the water system, plumbers, facilities management, sometimes even housekeeping. Ability to identify control locations. Ability to identify and take corrective actions. ability to confirm program performance, and communicate about the program. These are all key activities of a water safety management team. But sometimes that's not enough. I mean, sometimes you might not have some of those core knowledge pieces, so you might need to reach out for outside support. And sometimes you might reach out to a water treatment specialist or an engineering firm that can help provide planning services to the healthcare facility. Here I've listed a few additional resources. Because there is no certification program for writing water safety management plans, what I think is important is to at least work with a certified water treatment technologist. And there's a link to AWT here, and there's a link to HCInfo, which is a site that offers water safety management plan templates and information and checklists. Very helpful site. So now we're going to move on to, we talked about the team, which is one place where public health can be involved in helping healthcare understand water safety management plans for CMS. The other thing that public health can do is help with verification and validation monitoring. So verification and validation are different. Verification is confirming that the activities of your plan are actually being done, and then validation is to confirm that your plan is working. So verification would be checking residual disinfectant at specific locations within the building, checking temperatures of boilers, checking the temperature of water at certain taps in the building, making sure that cleaning is done, making sure everything is documented, super important. But validation is looking at, is the program actually working? And for that, you really need to be actually doing water testing for the pathogen. And basically what validation testing is routine monitoring, right? So routine monitoring is something that we're all familiar with in environmental water. We're familiar with the total coliform rule monitoring. We're familiar with beach monitoring. We're familiar with wastewater monitoring. What you do when you do routine testing is you want to make sure that you have an upper limit, which you can't go across without having some actions after that. So you want to also make sure that you have a methodology that provides you with reliable, repeatable data. Because when you're doing routine monitoring, what you really want to make sure of is when you see a blip, like what's shown on this chart here, this chart shows going over the OSHA cooling tower action limit. When you see a blip, you know that that blip is true and that somebody needs to be doing something now. So routine monitoring is important, but it's also important to be reliable. And one of the questions that I get a lot, how do we choose a lab for validation testing? And should I be using a CDC ELITE laboratory? So this slide talks about CDC ELITE versus an accredited laboratory, and I'm sure that you all are probably very familiar with laboratory accreditation, either through your state programs or other programs. So the ASHRAE 188 standard that CMS refers to talks about the fact that if any testing is going to be done for a validation plan, that it needs to be done at an accredited laboratory. Now, the difference for CDC ELITE is that laboratories for CDC ELITE should be considered for environmental testing as part of an investigation into cases of disease. And this is in quotation marks because this is how CDC defines ELITE. CDC ELITE is a certificate of achievement. It is not laboratory accreditation, as we're probably a lot of us on this call are familiar with laboratory accreditation and having a quality system management program in place. CDC ELITE is not that, but it is used for investigation into cases of disease. Some laboratories have both, and that's a great thing, but at a minimum, make sure that the recommendation is that any routine monitoring is done at an accredited lab. And the accreditation could be ISO 17025, AIHA, MLAP, the TNI standard. So now we're going to talk about validation analytical test methods. So the traditional traditional test is a culture. I know that there are some laboratories that use quantitative PCR or just PCR as a screening tool to decide which samples they should culture, and that's great. Some labs just go straight to culture. The traditional culture that's been used in the past is called spread plate. So you can culture bacteria pretty much two ways. You can culture bacteria on solid media, or you can culture bacteria in liquid media. And if you culture bacteria on plates, you report your results in CFU, colony-forming units. And if you culture in liquid media, you report your results in MPN units, which is most probable number units. And that's described pretty well in standard methods for the examination of water and wastewater, the compendium of standard methods. So spread plate culture requires several steps. Dilution, there can be a concentration step where you do membrane filtration or centrifugation. There can be pretreatments like heat and acid. The results are available typically 10 to 14 days. And then confirmation steps are required to get to Legionella pneumophila and to serotype Legionella pneumophila 1 versus 2 through 14. So the only problem with spread plate culture is that everybody's vying for real estate. So you have a mixture of organisms on the plate that you've spread all over the place. And sometimes there are bugs on there that don't like one another, or there are bugs on there that behave badly by either swarming or producing toxins to keep things from growing near them. So there can be times when it's difficult to tell targets from non-targets, and there's an example on here. So the subjectivity of a plate can be frustrating at best sometimes for an analyst. But you do get interference on a spread plate from non-Legionella organisms. And reading plates like this, and of course, you know, not all of them will look like this, but a good majority of them do. And it requires a pretty high level of analyst experience in order to get a good count of this plate. These are the basic steps for spread plate culture. You decide if you have high, moderate, or low counts. And then depending on if you think you have high, moderate, or low counts, your test protocol will be a little bit different. Typically, you end up with 6 to 9 plates, depending on how you do your confirmation. So there's a lot of stuff going on here. There are a lot of steps going on here. There are a lot of manipulations going on here. And if any of you are familiar with ISO 17025 or the TNI standard, what this says to me is measurement uncertainty. I don't know if everybody's familiar, but measurement uncertainty is what steps contribute to the analyst having faith, I'm using air quotes, faith or not in that the results are true and reflective of the original sample. There are several places where there are contributions to measurement uncertainty in spread plate culture methods. The concentration, you may lose organisms. The pre-treatments, heat and acid, you may also lose organisms. The media formulation, as long as everybody in the laboratory makes the media the same way, that's great. But if there's any deviation, that can be a contribution to measurement uncertainty. The media manufacturers themselves, if you pre-buy plates that are already poured, there can be a very big difference between manufacturers and the performance of those plates. And then reading the results from a spread plate can be different. If I read the results on a plate and somebody else reads the results on a plate, there isn't necessarily an exact match of that number. So all of those things added up together leads to a pretty high total measurement uncertainty value for spread plate culture, which actually was one of the drivers, amongst other things, for the desire for there to be an easier, more reliable, more repeatable methodology out there to perform this type of testing. And that's where the bacterial enzyme culture method comes in. This is a very simple method. If anybody's familiar with the Legiolert product that we produce, the procedure is very similar to that. It confirms Legionella pneumophila in 7 days as opposed to 10 to 14. It utilizes QuantiTray for quantification of the results. And if you look at this, the difference between being able to do a culture in 96 individual tiny little wells, what that does is it really isolates the organisms from each other a lot more than when they're on a plate. So what happens is you don't get as much contribution of interaction of targets and non-targets, things that are going to, inhibit Legionella pneumophila from growing have less chance doing that. You can serotype directly from the QuantiTray. We have a procedure for that. There are accreditation options through TNI, AIHA, and ISO 17025 as described in ASHRAE 188 and recommended by CMS. And also it is included for routine monitoring in the CDC ELITE program. This is the protocol as compared to the protocol for spread plate. You have a 100 ml sample. You determine the hardness. You add a supplement depending on the level of hardness. 1 of 2 volumes will be added. So you add the reagent media, pour it in the QuantiTray, seal it, incubate for 7 days, and your confirmed result looks like the one on the right. Brown color is positive, no color is negative. There have been several validations and publications on this particular method. They're all listed here. I think there are 3 additional peer-reviewed publications due before the end of this year. And there are links here if you would like to read any of those. So let's summarize. Legionella pneumophila is the #1 waterborne pathogen today, as shown through the data that CDC has published and as acknowledged by the World Health Organization last fall. Pneumophila takes advantage of certain areas in a water system and then can multiply and thrive. The vast majority of Legionnaire's disease can be prevented with a good water safety management plan. 9 out of 10 can be prevented. The opportunities for public health in the building awareness is be a resource and be involved. Remind stakeholders that Legionnaire's disease is deadly, but it can be prevented. I know I've said it 20 times, but it's true and it's important. An effective water safety management plan is extremely important. It's important to understand who does what and have them understand who has responsibility for which part of the program. Educate your local, healthcare building owners and managers about ASHRAE 188 and the CMS requirements. Maybe you can hold learning sessions at your laboratories and bring all the stakeholders into one room and talk about who would be on the water safety management plan team, who would do what, map it out. How often would you meet? Would you meet monthly? Would you meet quarterly? Would it depend on the results of your verification and validation testing? But get everybody in the same room and have everybody understand what their roles and responsibilities are. You can also encourage local laboratories to become accredited and offer Legionella pneumophila validation testing to support these people. And here we have some additional water safety management resources. This is AWT's website again, HC Info's website again. The ASHRAE standard can be viewed and or purchased here at ashrae.org. Information on Legionella in general and the CDC is there, and information and a directory of testing labs is the last link. And here are the links to the accreditation standards and analytical method resources. And with that, I think we will take questions.
Thank you so much, Patsy. We are now open for questions. You can use the chat box in the upper right-hand corner of your screen. It says Q&A. Click on that, and then you can type in your question and hit submit. We will do our best to get to all of your questions, but you can always submit a question to water@IDEXX.com or visit IDEXX.com/water for more information. All right, are you ready for the first question, Patsy?
I am.
Okay, we're going to start with an easy one.
Okay.
Where can I get a copy of ASHRAE 188 or the CDC toolkit?
Okay, so ashrae.org is where you can get the ASHRAE Standard 188. And then if you go to cdc.gov and type in CDC toolkit, you'll be able to find that. But I also have links on this webinar. If they want to, they can get them there.
Why don't we send those out to all of the participants after the webinar? We can send out an email with links to those resources.
Okay. Yeah, sure.
So yeah, we can definitely do that for everyone. The other question, referring again to ASHRAE 188, how much does it cost?
So I believe it's like around $70 to buy the standard, which is actually pretty cheap compared to most other standards organizations. Probably less if you're a member.
Do you have to be a member?
You can be a member, but you probably get a discount if you're a member. But the CDC toolkit is free. You could start there.
Free is always good.
Free is good.
Yeah. Okay. Yeah. And then do you have to, then you said that everything in ASHRAE 188 is in the CDC toolkit in a much simpler way to understand, or?
Yeah.
That I'm not saying anything about regulatory people that they can be confusing. Regulatory can be confusing, but so would you recommend that maybe they do the CDC toolkit first?
Yeah, that's probably a good idea because it's pretty simple to understand, and then if you have any questions, you can go on to the ASHRAE 188. But they really do work in tandem. It's a really good idea to have both.
Okay, great. And we also got a question about getting a copy of the slides. We can also include that in the email, the follow-up email to everyone, along with the links to the CDC toolkit and the access link to ASHRAE 188 that Patsy was mentioning earlier. We'll send that out after the conclusion of the webinar.
Yeah. Okay.
Another question that came in about CDC ELITE labs. Why not use a CDC ELITE lab for validation testing? And before you talk about that, can you please explain what a CDC ELITE lab is again, please?
Oh, yeah. So CDC ELITE is a want to go to slide? Okay. That's all right. I'll make sure I go to the right one. Nope, I didn't go to the right one.
35.
Oh, 35.
Yeah.
Okay. Let me see if I can.
If I do that while you talk.
Okay, you want to do it and I'll talk. Okay, so CDC ELITE was started several years ago in response to CDC's need to have a consortium of laboratories that could help them perform analytical testing during an outbreak. So they get 2 test samples a year. They have to be able to show that they can find Legionella in the samples or not, and then they get a certificate. But it's really it's a chasm like between what CDC ELITE is and what laboratory accreditation is.
So it's not an accreditation program.
No, I thought I said that, but maybe I didn't. I did. It's not an accreditation program. So.
Okay. The lab that I use says that they offer the CDC method. Is that what the CDC wants to see?
That's another good question. CDC does not endorse or promote any methods. CDC came up with this method in 1994, and that was just the nickname or the name of the method. It's very similar to the other methods, standard methods 9260J and ISO method 11731.
Okay.
Yeah. But it's not preferentially used. Okay.
Okay, great.
And you can use an ELITE lab for routine monitoring, but if you're going by ASHRAE 188, hence the CMS, the requirement there in Annex C is to use an accredited laboratory. But some of them might be both, which I think I mentioned as well.
Okay. Great, thank you. Do you need to use any personal protection equipment when you are handling samples for Legionella?
That is up to the laboratory's QA officer, which is another reason why you should be using an accredited laboratory, because they have people that are designated in their laboratory, in their org chart, to understand that. I know our laboratories here, you know, they don't use personal protective equipment or gear with the samples that they have. That's another good thing about this particular enzyme method, is that it's all contained. You know, you can't spill it, you can't open it, you can't aerosolize it or anything. So,
okay, great. Are we expecting any federal guidelines to come out for sampling or monitoring of Legionella? New York seems to be setting the standard for healthcare testing.
Yeah. So right now, the only places in the world where there are actual regulations is Germany, France, Quebec, New York, and the CMS rule. Those are like full-on regulations. As far as any additional regulations coming out in the United States, where first of all, CDC is not a regulatory body. They can't write rules. But the EPA hasn't determined a position, as far as I know, on regulation other than what's mentioned in 40 CFR 141 about treatment techniques. But I don't know. The VA has a policy where every VA facility has to be tested under their policy. But I do agree. You know, New York has done a fairly good job in getting the cooling towers and then healthcare under control. But it would be nice if states and or one of the federal agencies would do something proactive instead of reacting to an outbreak.
And how difficult is it to have regulations around testing?
It depends on how important it is to the state. I think at this point it probably will have to be states. And what may happen is ASHRAE 188, because it is an ANSI standard, it may get adopted by International Code Council and then become available for states to incorporate into their housing or plumbing codes. And then at that point it would be mandatory. But that's a long ways off.
And if anyone should know about
long ways off.
Yeah.
Yeah.
How often should a facility do validation testing?
As often as they feel is necessary.
That's kind of a vague answer.
Isn't it? Yeah. That's kind of what the standard says, too. This is why the water safety management team is important, because that's the role of the water safety management team. If you have a small, you know, maybe 20-bed nursing home, maybe you only test once a month in a couple of different areas. If you have a giant, you know, 400-bed hospital, you're going to do something different. So it really is, it's the water safety management team that comes up with that.
And I know you mentioned the resources available to help put together a water safety management plan.
Mm-hmm.
Can you talk about those again?
So the resources to create a water safety management plan, first of all, it could be, you know, the CDC toolkit is really good because it has a bunch of checklists and a bunch of FAQs and things. HC Info is a really good resource. They have a lot of templates to create a water safety management plan, a lot of technical information about what you should be looking for when you do a risk assessment, where you should be ensuring that you have verification controls, maybe additional, you know, disinfectant and things like that. You know, if you Google water safety management planning, you come up with a lot of engineering firms and a lot of consultants and things like that. But if your water safety management plan team thinks that you are going to have to put something in place to mitigate some of the risk in the building, you're better off looking for somebody that is a certified water technologist, water treater, through AWT's program. It is a third-party program at AWT, but I would strongly suggest that.
Okay, great. And as mentioned earlier, I will, once we finish the webinar, we will make sure that we include all of these links to the resources that Patsy mentioned in the presentation. As a follow-up to the Water Safety Management Plan, can you just talk a little bit, we had a couple questions about liability around Legionella and if there is an outbreak. So does the Water Safety Management Plan, does that exempt you from liability? Maybe you could talk a little bit about that.
Sure. I mean, legal stuff isn't my core competency, but I can tell you what I've heard others say, right? So if there is a standard out there and you have the opportunity to implement the standard and reduce the risk through all of these particular activities, and you choose not to do it, I would think, and I'm not a lawyer and I'm not in that field, but I would think that if something happens at that facility that chose not to do this, that you are probably at a much higher risk for litigation and loss of, it just wouldn't be good. So if you know that there's something out there that can help you reduce risk, 9 out of 10 outbreaks, we can reduce 90% of the cases if we just have a water safety management plan in place that somebody is paying attention to and the team is meeting on and doing verification and validation testing. If you choose not to have it, I think it's not
like
a good place.
It's a statistic that's hard to argue with.
It is, yeah.
Okay. Another question came in about holding times. Can you review the holding times for testing? We're concerned with invalidating tests for failures to meet hold times.
So there is no consensus on hold times. There is information in several standards compendia, like in standard methods for the examination of water and wastewater, that talk about how long samples should be held, and I trust this particular compendia that's been published for over 100 years by microbiologists way smarter than me. So I would refer to something like that. And the important thing when you do validation or routine monitoring, just like any other routine monitoring, you want to try and keep as many of the things the same as possible. So your accredited laboratory will, make sure that your samples are at, a certain temperature, that they've been held for a certain period of time, and the laboratory is a gatekeeper for that. So I would say look to your standards for information.
Okay, great. Thank you. Question about being accredited. Is there a way to get accredited for the Legiolert method, or is it only for the ISO method?
Depending on what you have or what standard you use as the basis for your accreditation, you can add Legiolert to an ISO 17025. You can add Legiolert to TNI. If your state program is based on TNI, one of those 17 states, you can do that. You can add it to your scope of accreditation if you're AIHA through the MLAP program. There are a lot of different options.
Okay, great. There's actually a couple of protocol questions. For sampling potable water, is it better to use the 10 mil or 100 mil method?
It depends on the sample. The 10 mil protocol does not require any additional supplement. The 100 protocol does. So if that's a decision-making thing for you, you could choose that. Okay. If your potable water, if you think your potable water may not be so much potable, you might want to choose to do the 10 mil.
Okay, great. Thanks. And then the follow-up to that is, does the Legiolert insert outline how to differentiate the serotypes?
Differentiate serotypes. Okay, so the serotyping is no matter which method you use, whether it's Legiolert, the ISO method, CDC, or standard methods, serotyping is a separate step, right? So when you serotype from the quantity tray, we have a protocol that can be shared with you where you take a scalpel to the back of the well and extract the fluid and do the serotype from that.
And that procedure is outlined in the insert?
I don't think it's actually, it's not in the insert, no.
So if someone has questions about that, they can call IDEXX Technical Service?
Yep.
1-800-321-0207. Again, that information will be in the follow-up email after the webinar. Question about what else can we do? How else can public health help hospitals be compliant with CMS?
I can't say it enough times, but I think that public health is looked at as the leader in disease prevention and public health protection. So I think, to me, the most important thing that public health can do is reach out to the community and have learning sessions. What is a water safety management plan? What are the steps? Who does what? Here's who should be on the water safety management team. I think that's probably the most important thing that public health could do to help these hospitals and nursing homes be compliant with CMS.
Okay, great. In addition to also looking into developing a water safety management plan.
Mm-hmm.
Okay, great. We have one more question about Legiolert being EPA approved, which I think you kind of covered in an earlier regulatory question, but is Legiolert EPA approved?
No. Neither, yeah, but neither are any of the other ones either. And that's because EPA doesn't require routine monitoring for Legionella. So they don't have that. Yeah, that was an easy question.
That was an easy question.
Uh-huh.
I wanted to close out with an easy one for you.
Thank you. I appreciate that.
Thank you so much, everyone on the phone, for listening in on the presentation. If you do have questions, as I said earlier, you can always submit your questions to IDEXX, to water@IDEXX.com, or you can visit IDEXX.com/water for more information. In addition to the follow-up email with the resources, you'll also be receiving a survey after the webinar. We'd really love to get your feedback on this webinar, as well as any other topics that you might like to see in future presentations. I'd like to thank Patsy Root for this informative presentation, and thank you to our audience for spending the past hour with us. For IDEXX Water, this is Nancy Leonard. Thank you so much for joining us, and have a wonderful rest of your day.